Hi to everyone. I'm ceaselessly impressed and grateful for the incredible attendance that these sessions see on a regular basis. And thank you all for being here again. And by the way, my bad, I'm working from a desktop, so I'm not visible because this screen doesn't have a camera built into it. I guess I'm working with last century's technology. But this is quite a time for this. And you know, this is a topic, as some folks, Steve Schroeder, foremost among them, will appreciate. There are entire books written about. But so let's regard this as kind of the speed dating approach to taking a look at harm reduction in tobacco control. So I've been asked to briefly discuss this concept of harm reduction. It's a fascinating area, both practically and academically. It's one that's become increasingly relevant to the field of tobacco control, particularly since e-cigarettes became a going concern in recent years. Before that, the only potentially viable options for harm reduction essentially included nicotine replacement therapy, which has never been marketed in that fashion, but rather solely for cessation, and then potentially some smokeless tobacco products like snus, but the latter with very little acceptance. So, while pretty widely accepted in certain other fields, and I'll touch on that a little bit, harm reduction has struggled to gain traction in tobacco control, although it does now have major proponents, certainly. And the countries, particularly the United Kingdom, have made it a central focus of their policy strategies, very, very different from our environment here. So these days, as we all know, e-cigarettes are making headlines with the new federal push for restrictions on flavors and continued reports of illness and death following certain types of e-cigarette use. And then, of course, you know, ongoing questions about Juuls, in particular, Juuls marketing directly to youth and use of modified risk claims, which the FDA is now trying to hold them accountable for. So, you know, things have been so fraught in this area that I contemplated in recent days, and Becky and I discussed it, how timely it would actually be to address harm reduction at this particular moment. But it is certainly something that can be addressed. And so I'm pleased to do that today from a fairly simple and I hope informative perspective, notwithstanding the general firestorm that we're currently experiencing. I would posit that harm reduction as a concept in tobacco control isn't dead in the United States, but we will have to see how things develop in the coming months and beyond. So, you know, where we start from, as you can see right now, and you've all seen this before, and it's really fundamental to addressing this issue, and that is, it's cigarette smoking, it's combustible tobacco use. That's really the context for this entire discussion. And we know that when we add up all of these prominent, well-known causes of premature death, which now include opioids, we've added to this visual in more recent times. When you add up all of those together, they total about two-thirds, not even two-thirds, closer to 60% of the annual toll from cigarette smoking. Next slide, please, Becky. So just a few basic facts about combustible tobacco use. Again, this should be just a refresher for you. Cigarette smoking is responsible for, you know, essentially virtually all, but, you know, percentage-wise, about 98% of tobacco-related deaths in the United States. Cigarette smoke contains 7,000 chemicals. There are 70 known human carcinogens, roughly 500,000 deaths per year, and 42,000 of them from secondhand smoke. And, you know, something that, of course, we emphasize from the American Cancer Society, roughly 29% of all cancer deaths in America are due solely to cigarette smoking. And of course, and I've highlighted this, cigarette smoking remains the only legal product that kills half of all long-term users when used precisely as intended by the manufacturer. It's a remarkable, remarkable statement. Now, one thing I thought I'd note here, again for perspective, is for very good reason, there has been a lot of focus on the state of serious pulmonary illnesses, which have now, as of the last day or two, resulted in the deaths of 7 people in the United States from vaping, products that appear likely to have been adulterated involving THC and vitamin E acetate, as I understand it. But to provide a little perspective here, since these reports began to emerge on June 11th, cigarettes have killed approximately over 124,000 Americans. That's pretty remarkable. And I want to thank our great ACS colleague, Alex Lieber, for having created the slide for another presentation that he gave at the University of Michigan just yesterday morning. Next slide. So at a very basic level, what is harm reduction? Well, there is no single definition, but what I thought I would do is provide an example that you can currently find online to get a sense for what we're talking about. Next slide. So I went to the website of the Harm Reduction Coalition, and I'd just like to read through this to do a little bit of table setting. And I highlighted a few things that I thought were key phrases or individual words. So they provide their principles of harm reduction. Harm reduction is a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. Harm reduction is also a movement for social justice built on a belief in and respect for the rights of people who use drugs. Harm reduction incorporates a spectrum of strategies from safer use to managed use to abstinence to meet drug users where they're at, addressing conditions of use along with the use itself. Because harm reduction demands that interventions and policies designed to serve drug users reflect specific individual and community needs, there is no universal definition of or formula for implementing harm reduction. However, the Harm Reduction Coalition considers the following principles central to harm reduction practice. Next slide. So they say then, and I've been a little bit selective and included the bullets here that seem most relevant to us. Accepts for better and or worse that licit and illicit drug use is part of our world and chooses to work to minimize its harmful effects rather than simply ignore or condemn them. Ensures that drug users and those with a history of drug use routinely have a real voice in the creation of programs and policies designed to serve them. Affirms drug users themselves as the primary agents of reducing the harms of their drug use, and seeks to empower users to share information and support each other in strategies which meet their actual conditions of use. Recognizes that the realities of poverty, class, racism, social isolation, past trauma, sex-based discrimination, and other social inequalities affect both people's vulnerability to and capacity for effectively dealing with drug-related harm, and does not attempt to minimize or ignore the real and tragic harm and danger associated with licit and illicit drug use. So, you know, if you were thinking about this and looking at some of the descriptive information here, as I was quickly running through it, some of it probably triggered some familiarity with regard to disparities and social justice and helping people where they are. You know, when we talk about the cigarette smoking epidemic and the issues that have arisen with the emergence of e-cigarettes and an interest in harm reduction and tobacco control. Next slide. So I thought this would be the right time as well to note that the FDA in 2017 proposed an approach based on a harm reduction conceptualization of how regulation might work to support people quitting, but in the absence of quitting or in lieu of quitting, being able to at least engage in tobacco use that was far less hazardous. The question now, of course, is how the agency will approach this in the current increasingly volatile environment. But in 2017, what they proposed to us was recognition that there is a continuum of risk for tobacco products. They are not all created equal. Of course, cigarettes are at one extreme, the major killer. NRT, nicotine-containing cessation medications like gum and patch and inhaler and so on, are at the other extreme, reviewed and approved as safe and effective by the agency, notwithstanding that they do contain and deliver nicotine. And then e-cigarettes, somewhere in between, with estimates ranging fairly widely, but regarded as demonstrably less hazardous than combustible tobacco products. Not 100% safe, but less hazardous to be sure, in general. The agency also proposed And this rule that they were talking about back then is expected, at least as of now, to go public and be published within the next month or two. So we should be seeing something about this pretty soon, but requiring manufacturers to reduce nicotine in cigarettes to non-addictive levels. That actually, among all of the policy options out there, if successfully adopted, if it got through the process and withstood industry litigation, stands to be probably the most dramatic tobacco control policy change probably in history. The modeling predicts that some tens of millions of people who otherwise would have died from cigarette smoking in the U.S. Would not. And the smoking prevalence among adults would probably drop to the range of about 2% or 3%, because as a guy named William Dunn, who used to be a top scientist at Philip Morris, said way back in 1972, without nicotine, there is no smoking. Next slide. So a couple of key considerations that I think we all keep in mind here is, first of all, no one, kids and adults alike, should start using any nicotine product, including e-cigarettes. Kids simply should not use nicotine, and adults who are nicotine naive, in other words, they don't use smoke or use other conventional tobacco products now, certainly should not, ideally, from a health perspective, start to use nicotine in any form. Another, I think, consideration to keep in mind is that to say something is less harmful than cigarettes is a very low bar. Again, considering the enormous harm that cigarettes cause. And I think that from our perspective, I think it's safe to say that truly effective harm reduction, if it is ever to take place in this country, requires significantly less harmful alternatives, which must fully meet the FDA's statutory requirement that, quote, the marketing of a tobacco product is appropriate for the protection of public health, close quote. So in other words, has a demonstrable net public health benefit. Is not just another alternative out there, but without proven benefits to reduce harm and reduce, mortality. Next slide. I thought I'd leave you with a visual. Again, I thank Alex Lieber for having produced it. We have new preliminary data from the National Youth Tobacco Survey. And again, this is not final, but it has been released by HHS, which shows the new prevalence rates for vaping by high schoolers and smoking by high schoolers. And you see quite an interesting kind of dynamic going on there, and you can draw your own conclusions, but vaping has really gone sky high among high schoolers, up to about 27.5%. And by the way, that's all high schoolers, so one can surmise, and maybe we likely will see these figures down the road, that if you're looking at high school seniors, it's going to be markedly higher than that because they vape at considerably higher levels than, say, ninth graders. At the same time, we are seeing historically remarkably low cigarette prevalence among high school students now at about 5.5%. Now, there was some concern last year when we saw vaping, of course, jump by 78% up to about 21% prevalence. And there was also a slight uptick, not regarded as significant, but still a kind of a stagnation there in cigarette smoking by kids from 7.5% up to about 8%. And we were really interested in seeing, is that going to continue to rise at the same time that vaping does? But what we saw in the past year, according to the preliminary data, actually, when it comes to smoking, the 800-pound gorilla in the room, it's extraordinarily good news. And yet one more thing that our high school kids can tell us they know better than we do, because they're now down to about 5.5%, and adult smoking prevalence is somewhere between 13 and 14% as of now. So I think if we go to the next slide, we have reached the end of the speed dating version of addressing tobacco harm reduction. I'm sure there are many questions. I have to say that having worked on these issues for 3 decades, that this is a remarkable moment, and it's one that we have not seen, similarly, over all of these years of working on these issues. Things could cut in various, very different ways. There is some significant risk that we're looking at right now for reasons that we all understand very well. But I think that we can continue to hold in our back pockets the possibility of there being potential for harm reduction to play a meaningful role in our fighting the tobacco epidemic, and we shall see how things play out. So Becky, that was my real quick look at these issues, and happy to engage in any Q&A.
Thank you so much, Cliff. We have a question in the chat box from Jamie. So she wants to know about the likelihood that manufacturers will be made to reduce nicotine to non-addictive levels, and how enforceable is that?
Sure. Great question. You know, it's not disclosure exactly, but I've been working on that issue since before it was part of the public discussion. Literally, I proposed the potential for eliminating the addictiveness of cigarettes starting back in 1992 when I was working with a whistleblower from R.J. Reynolds, who helped us understand that the cigarette companies had complete engineering control over the appearance and the amount and the delivery of this addictive drug in their products. They can remove it today. They actually have done it in some situations. So, you know, part of the FDA's authority is to exercise accountability over the industry. The industry is required to turn over all relevant scientific information to the agency, information about chemistry, information about engineering, product design, as well as other issues like marketing. So it is presumably scientifically and regulatorily enforceable. Now, the industry has already made clear, and they didn't even have to make clear, that if and when the FDA moves ahead with this rulemaking process, that they will sue. They will do everything in their power to block the FDA from moving ahead with this initiative. That's not a new strategy by any means, but they will fall on their sword before they sit back and allow this to move forward, because they know that their entire industry is based on addiction. And without it, things will change dramatically for the better from our public health perspective.
Thanks, Cliff. And Catherine, my CLC is asking, in California, Governor Newsom wants to develop recommendations to remove illegal and counterfeit vaping. So can you explain what's classified as an illegal vaping product?
Well, at the most basic level, and I appreciate the question, I saw the announcement of Governor Newsom's proposal. I understand that he's been given to understand that they need to go through the legislature to move ahead with some of these proposed measures. He said that he's interested in down the road completely banning, if I got it correctly, but correct me if I'm wrong, vaping products entirely in California. Frankly, for reasons that I think we should understand through the harm reduction lens, that could be a disaster. But what's necessary here is that the FDA exercise its authority to regulate these products and require, as they, through court order, because our health organization sued the FDA to ensure that they would move ahead with this, to require that all of these products go through a formal pre-market review process at the agency, and that they review it based on the standard that I noted a few minutes ago, which is, you know, whether they will serve the interests of public health. And technically speaking, right now, every vaping product on the market is arguably illegal because none of them have been submitted for or gone through pre-market review. But as of now, they have until March to submit their applications. Some vaping/cigarette companies will do so. We have a kind of a brave new world that may be developing in the coming months, and we'll see what that looks like. As far as removing illegal and counterfeit vaping products, in other words, those that would never go through review because they're kind of, sold and marketed on the street. Well, that's a law enforcement issue, quite frankly, and we may be headed toward that type of action taking place more than it is right now.
Thank you. And then I know a question on everyone's mind, and Steve, I wondered if you might speak to this. What should medical professionals be telling their patients about e-cigarettes right now?
Thanks, Becky. Great summary by Cliff. I think the question on everyone's mind is, why are these pulmonary lung issues happening with vaping? And the CDC is still conducting an investigation. But from what I've read and what I know, it looks like the vast preponderance, and maybe all of them, are due to adulterated products, not the products of the companies making the e-cigarettes that people are buying off the street and that have a cannabis. So the bottom line is, don't get illegal products, don't put them in your vaping. To be absolutely safe, you probably ought to stop vaping. But for those smokers who are using vaping to quit smoking, if the option is to go back to smoking or to keep vaping, then I would say don't go back to smoking. So that's a sort of a nuanced answer.